collagen. Okay. Morning to everybody. Thanks to be with us today. I'm with you to speak about collagen, and I'm very happy to be in this place and with a doctor that is, with Gabriele and Roberto, that will be so fine to have us, to give us the possibility to have this speech with you. I will start asking you how many of you will be happy to earn more money. I think everyone. How many of you will be happy to have more client, more patient to treat? Of course, everyone is working and trying to increase or to make to have more patient and more experience in this work. So the idea is how can we answer to something like this? I believe the answer will be that we need something different, something new that gives us the possibility to be in a small number of people, of doctors, using something that everyone else has not. So at least at the beginning, having something new means that you are the only person that can be able to perform that kind of aesthetic medicine. And this is the idea that we are riding at the moment. I'm Dr. De Pasquale, and I'm working for Taomed, that is an Italian brand that has got this new idea of collagen. As you know, nowadays advertisements speaks all the time about collagen. So it's not something that we discover, but we understood that the idea, the brown new idea, that is really old, is collagen. If you go on the market, if you see all these aesthetic things are made with the idea of collagen. So why we believe in Karisma? Because the idea is that if Vichy, Filorga, Sloder has got the idea of collagen, and a really big firm, means that collagen is what people is asking now, okay? And why we think that we'll have to use now.
What does your video sound like? Go to artlist.io and get the best music and sound effects for your...
That is not so much experience. It's a new product. Something is more than a year that is on the market, but for a product is not so much. Because I believe that if I want to be the winner, I need to start first. Who is in pole position in Formula 1 is able to arrive first. So my idea is, if I want to win, I'll have to start first, trying to get the possibility to arrive first. I've got more possibility. Of course, if the product is what I say, a lot of people will start with that product. But you have got already so many patients, so many people coming in your clinic that you are satisfied in that way. So why Karisma, what it is recombinant collagen. Recombinant collagen means that is a collagen made in a special way that gives us the possibility to get only one chain of the collagen. Collagen is made with 3 chains, okay? Alpha 1, alpha 2, alpha 2. What we be able to perform is to build up an alpha 1 chain. This is very important to explain because the mechanism is made in the way that is really safe. There is no problem of allergy, because even if it's a product coming from the silkworm, is a product that is 99% similar to our collagen, and this means that we don't need to test anything, we don't get any allergy. On the other hand, is a new concept, because we've been using till 20, 30 years hyaluronic acid, and we get something immediately. You inject hyaluronic acid and you get the result. It's different with the collagen. It's something connected like stimulation of your collagen. This is the meaning, because we have got only one chain, and also because we reduce any possibility of allergy, having only one chain. The chain that we insert in our body stimulate our body to build up the other alpha 2 chains, having so a new collagen made from you, not from us. And this is the gap that we need, speaking in days and time, to get the result. It's not something that you get immediately, but it's really natural and is nice, smooth, like something that we are looking for. This is what I told you. We start from Pro Collagen, that is the alpha 1 chain, then get the other 2 chains to reach the 3 chains of collagen. Is something that is made inside the dermis, and that is a natural procedure. Okay, so when we speak about KARISMA, we speak about an alpha chain, alpha 1 chain of collagen mixed with high weight hyaluronic acid and carboxymethylcellulose. This is the 3 main, but even if we have got also hyaluronic acid and carboxymethylcellulose, I will explain you that the main product that is working is not the hyaluronic acid and is not the carboxymethylcellulose. They are mixed to get the right environment to make the collagen works in the right way. So the result want to be connected with the hyaluronic acid that is going to disappear in short time. So we cannot consider the hyaluronic acid the right product to get the result, but it's the collagen that when we introduce the high weight hyaluronic acid is able to build up new collagen. Okay. Is the recombinant collagen, like I told you, is coming from silkworm. This means that is very nice, because we can get something that is 99.9 similar to our collagen. So has got a high solubility, and is something that we get from the silkworm through hydroxylated the product that is coming from the worm. So why silkworm? Because the silkworm is has got no disease in common with the human body, so we can be happy to have this kind of product, having no problem with disease in common with this. We can produce an awful amount of collagen, and it's safe, and then we can get the human alpha 1 collagen that is practically the same of our This is the meaning. It's something coming from Japan. They started thinking about this collagen for aesthetic reason, cosmetic, okay? And then the idea of the boss was to use this collagen not to make cosmetic like a Slaughter or other film, but to use as an injectable collagen. Now we have got this idea of alpha-1 chain that is able to increase the production of collagen type 1 C-peptide. You know that a collagen, we have got something like 29 different types of collagen in our body, but what is interesting for us, I mean, speaking about skin, is type 1 and type 3. And so the type 1 is what we are looking for the dermis, to increase the amount of collagen in the dermis, things to have more volume, even if I don't want that you think that we use this product to get volume, and because we'll be wrong in the way to think. The alpha-1 chain is going to stimulate the production of pro-collagen triple helix chains, and so this means that from one chain we got the 3 chains that the collagen. So triple helix is made from alpha-1 and 2 alpha-2. So alpha-1 chain is a product that is connected with the biosynthesis enzymatic modification of collagen, and then is working on the extracellular matrix, and this is something that is connected with the subcellular structure. So is working also on inflammatory response process to get a platelet activation. As you can see, is working on many procedures in the dermis, in the extracellular matrix, that is our target, okay? So why collagen? Because through many studies we saw that the amount of collagen by the time, with the age, seems that after 40 years is going to reduce 1% every year. This means that we can say that getting older it's connected with a reduction of collagen. If we are able to increase the amount of collagen, it means that we can fight, let's say, with the aging of our skin and our look. Okay, so why using also macromolecular hyaluronic acid? Because the hydration and maintenance of the right environment is able to help fibroblasts to build up new collagen. So we need, for this reason, and has got also an antioxidant action. So for the same reason, we put inside carboxymethylcellulose. That is a molecule that our body is not able to metabolize. So it's nothing new. We, like the hyaluronic acid has been used in many products that most likely you are using at the moment. You don't know that you are using this kind of molecular, and is lasting for a long time, and is giving the right environment for the collagen. So is going to inhibit the action of the hyaluronic acid and preserve endogenous hyaluronic acid and slow down the action of metalloproteinases. Okay, that is so. KARISMA is coming out in this way. Is a 2 ml syringe pre-filled with recombinant collagen, carboxymethylcellulose, hyaluronic acid, and the needle will be a 27 needle, gauge needle. The protocol is something that we suggest to be done with 2 sections with an interval of 30 days, 28, 30 days, doesn't matter. What means it means that you don't need to make the 2 injections too close one together, because we need time for our body to build up the new collagen. So if you do the two injection too close, you don't get the right result, or you don't give the possibility to your body to build up the collagen. I say always, if you go in a gym, you don't go 3 times a day. You go one day, then you rest, and then the next day you go again, because your body needs rest and needs time to build up the new muscle. The idea is the same. We'll have to give it the right time to our body to build up the new collagen. And we understood that the turnover is something like 4 weeks. This is the meaning. We suggest to repeat the section of 2 injections after 4 months or 6 months. It depends how old is your patient and what do you want to get, of course. If she is someone really young, you can do twice a year, having a nice result that keep longer. If she is someone that needs more help, of course, every 4 months, it means 3 times a year, will be much better. Okay. The protocol is 30 minutes. It depends how do you work, of course. You take your time and you do your work. As I will tell you and show you, you can use a needle and you can use a cannula. I started with a needle, but I'll have to say that nowadays I enjoy cannula because I've got less bruise and it's more safe. It's easier to reach the right plane if I want to work with a cannula, but everyone can choose his way. Okay. Technique: superficial and mesodermal injection. I don't suggest to be too superficial. You will have to remember that we've got inside the carboxymethylcellulose that is something hard, and also the hyaluronic acid. So if you leave your product too superficial, will stay there superficial, and your patient will complain because he can or she can feel the product under the skin. So I don't want to say deep derma, but you can use it, but medial derma for sure. I will show you some case just to understand what you can get and what is our idea to restoring the skin. Is not a fill up, as you can see. You can see the wrinkle is there, but the quality, the texture of our skin improved a lot. This is what collagen is doing. And on the other hand, this is another commission around the mouth. As you can see very well where I put the product that is on the marionette lines. So another nice discovery that we made about collagen is that the collagen is moving the metabolism of the skin. This means that when I used the product on her forehead, because she was wishing something different for her forehead that was with many marks, I didn't expect that the collagen would be able to cancel the spots. We made some studies and we understood that moving the metabolism, what you can get is also that there is some melanin that is, with the age, is difficult to move from the skin. This is the reason why aged people has got spots on their hands, on the face. if you increase the metabolism of skin, and this means that you can remove some marks from the skin. Is not something, we don't use the collagen to remove spots, okay? But you will get an improvement of your skin also in the texture and in the color, and this is something nice for your patient. Difficult skin, what can I do? If I put the hyaluronic acid inside, I can fill up, but the quality of the skin is still the same. While using this kind of product, I got a nice improvement. The lady, as you can see, is not so young, but she was really happy with the result, and I was happy too. And what I didn't expect, that after the first the second step was this one. In let's say 8-10 months, I've done the second 2 injections, and I got another improvement. So we understood that the product is still working for a long time on the face and on the skin where we put the product. As the procedure can be done in a retrograde linear technique and in the opposite way, going in the superficial or the deep dermal injection, okay? Of course, periorbital wrinkles are difficult to treat. You don't, in this case, you get an improvement of skin, and this is not working like Botox. What I mean is that you don't move your forehead with this kind of treatment. You improve just the skin. Is more hydrated, and the wrinkle will disappear or improve a lot, let's say, okay, to be sure that you will say the right things, without move anything, okay, or without stop any muscle to move. Is a different kind of result, but it's something that you can get in a nice way, making some injection in the periorbital wrinkles. Neck is difficult area. I don't know you, but I was in trouble for a long time with the neck. I do nowadays I do the neck always with the cannula to be sure that I don't want to do anything wrong. For the same reason, I have got nice result because I was not able to reach anything that I enjoyed really. Patient was happy for 3 weeks, and then she will complain again because the neck was going down again, and there was not. It's difficult to use Botox. Is a label use the Botox on the neck, at least in Italy, but you can do very little. On the other hand, hyaluronic acid won't help me in any way. So the idea to restore the skin was the right thing to do for these people, for this patient. The other way that you can use the procedure, once again, the marionette lines or nasolabial folds, or the nasolabial fold. As you can see, you can have an improvement of the skin. The nice things that speaking with you, I say that I want to have more patient. More patient means I have also men in my office. Men doesn't like have hyaluronic acid because it's swollen, so they don't like to have something too big, or that someone can say, what have you done? What's happened to your face? While using this kind of a product, you have got something natural, making a rejuvenation without any swollen. This is the idea. On the other hand, the last technique, like I told you, is the cannula that is not traumatic. you can use a cannula long 7 centimeters. It means that if you go inside from this place, you go down and you can, with a single spot, you can distribute all the product in the face, on the, let's say, medial and inferior third of the face. Easy to find to the correct plane, because the cannula cannot be too superficial. It's always in the medial dermis, and you can be sure that you cannot make any mistake in this case, in this sense. The disadvantage is that the skin is not stimulated. Of course, if I make a lot of point with my syringe or with a needle, is a stimulation for the skin. Even if I don't put anything inside. This is the idea of a single injection, and like you see, wrinkle is there, but there is a nice improvement in the quality of the skin and in the texture of this lady, middle age. As well as I enjoyed the work done with her. You can see where I was inside. I use to put a little bit of local anesthesia with the adrenaline. This is the reason why it is white skin, to avoid any bleeding. The other difficult area is the hands. How many times have you seen your patient with a nice face, a restored face, a face really nice, but then they've got old, aged hands, and so you think, okay, when I met, not patient, but a new lady that I don't know, I see the face, of course, but then you see the hands, and sometimes, I will say many times, there is no accordance with the face and hands. Okay, so this is an idea. You can get more patients in your clinic. Why? Because you can use this kind of a product in young ladies that they haven't got really a problem. So it's something that is a prevention, okay? It's something to keep her beauty for a longer time in her life. It means that if you are between 25, 30 years and 40, many times you don't need really to do any work, but if you do something smooth, will keep your beauty in the time. So you can use a point technique, linear technique, superficial dermis. I will say that the main maintenance in pre-aging will be 6 months, better than 4 months, and using our syringe 2 ml will be more than enough. She's young, she's nice, she has got no problem. Sometimes she fill up the lips because she enjoys for this. But the quality of skin is something that she's happy to have, and so I got inside in my clinic this kind of people that are really young and that haven't got any wrinkle, but I cannot do anything else with them. So I'm happy to do this kind of a job that is safe for me. On the other hand, our target is anti-aging for people aged over 50 years, let's say. Most of them are even over 60 and over 70 years old. So he's working microscopically and micro and microscopically because he is increasing the qualitative and quantitative alteration of the collagen fibers, and is avoiding the reabsorption of adipose tissue and bone of the face. And so the idea is to use this time 3-4 months will be fine. And I suggest you to use always the same amount of product, 2 ml, and always medium and deep derma. What about complications? mainly the only things that we can complain can be swelling that is connected with the recalling of water. Of course, the product is working in this way. So, especially if you are on the wrong plane, or if your patient, the problem is difficult to have this kind of problem on a face, because if you have a nice hydration or a recall of water, she will be happy. So this kind of problem can be connected with the décolleté, for example, where the skin is very thin, or in the neck where the skin is very thin, and you can notice these small bumps for sometimes. This is the reason why I prefer to spread my product in a better way to avoid spots that I can have with a needle. Okay? In conclusion, the nice things of this product is something connected with the chrono and photo edging. Can be used in, as I told you, having a nice restore of the skin, but for this and for the same reason we've seen that we used for small spots connected with the melanin deposit, or we can use on acne scars that can restore in a better way. Of course, not to older scar. We cannot do anything there. We can replenish volume, but don't think to use this for volume, because you make a mistake, okay? It's to restore the quality of skin. Is working, like I told you, on collagen. Is a recombinant collagen, and this is the idea. You won't find another product with recombinant collagen, with collagen. Okay, so what I mean recombinant, because there are some products that are made with the collagen, but is not human collagen. Is coming from horse tendon or from cow. It is something completely different. They're more painful, and they don't work in the same way, because you insert all the collagen, the molecular, not a chain, and so there are many difficulties to stimulate our collagen. Is something, if I have to say, that it's easy to use, safe, efficient. I will say that these three things, that will be enough to think for me that the product is working the way that I wish. I don't want to have a problem, so I want to save. I don't want to have a problem, and so I have to be efficient. My patient and I needed that both of us be happy with the product, and it's something new. It's only small number of people that start to use now. So if someone will have this kind of treatment, needs to speak with us. Okay. The future, we are thinking about to mix hyaluronic acid with the collagen to have something different. I mean, a filler that is working on the lips, for example, where we don't want to get a bigger result, something very swollen. But the idea to mix hyaluronic acid with the collagen means that we can get volume hyaluronic acid, not the same that we've been this time, and collagen that increase or to improve the quality of mucosa of the lips. So this is the idea. On the other hand, if it's working on the face, why don't have to work on your tummy, on the arms, on the legs, buttock? The point is that we need more product to get something the same. So the body will be more or less the same, but the amount of product that you are going to get will be more and more. And that's it. I think that's all. I would like to understand how many of you is using or is doing restoring for the face, revitalization on the face. I think many of you. Okay. So what we need now, or what we have been speaking to today, is just to give you something new that give you the possibility to choose. Having an experience is not something different. It's like if you drive a car, you know if a car is better than yours or not, or if give you more possibility to win or to reach the place first. And the idea of something new, of something different, of collagen is connected with this. Is anybody that want to make any question, or if I was not clear enough? I was very clear. Okay, thank you very much.
Results? We'll have them, the results. We'll have them after how many weeks?
You'll have to expect for the result, you mean. Let's say that in a month's time you see what's going on. Even if I notice that is increasing or improving, even after 2, 3, 4 months. At the beginning we thought that the result will last for a month time, while we understood that is going to last longer time. So it's nice because it's not something that, like I show you the patient that I've done the first time and then I've done again 4 months time. I didn't expect an improvement, and the second time I was there just to keep my result, worry that she can lose the result, and in different way I've seen that the result was different, it was increasing. Okay.
And after 4 months, when you do the new protocol, duration is
it's difficult to tell you anyhow, it's lasting. It's always, well, there is a point where you stop to improve. Of course, it's not an improvement forever. You don't come back as a. To be clear with the patient, you have to say that the first 2 steps, first procedure and second procedure, will be for him to improve and to have a nice result. Then what you do is just to keep what you have get, and will last. What can I say? In my idea can be to do the first year 3 times every 4 months, and then 2 times a year will be nice. It's a fidelization of the patient, that be happy when change the product and have another product that it is not able to give her the same result, will come back from you, because she want to have that kind of result that you give her. And with it, it's something that don't need to be done every week to get something. Yes, you can, will be less expensive, okay, for you, because you earn more money in 2 times, and you don't need to have your patient always in your office. And for her, because she do this and she feels that she can do something else. She's starting to think, okay, now that I've restored my face, that I'm happy with my skin, I can think to do something else for my eyes. The forehead, I will do the Botox or change the area. If I get something in this way, I'm waiting for the body, for the new body, because in my mind we've got a lot of product on the face. I've got difficulties up push up, of let you understand what's my feeling that it's already a year. I started to use the product when it was not on the market. And when it was given to me from the boss, he's not here, he said it's a filler, you can use as a filler. After 2 weeks, disappear everything. So that it's not working. And then we understood that it was working slowly in a different way. Not for volume, but for restoring the skin. Is something different.
I don't know, but it's possible to mix, for example, in one session, KARISMA and hyaluronic acid.
Of course.
To have a result.
Yeah, of course, you can.
And longer.
Yes. You get two different things.
In the same session?
Yes, you can. They are already mixed, but if you use a different kind of hyaluronic acid, you can get a volume, and you can get, yes, of course. It's a nice idea. Of course, if you want to be more complete, you will see the patient in a different way, or if your patient will be happy to have something more and pay you a little bit more, you can even mix the two products. You need a 27 needle, or as we can see this afternoon, a cannula, not too thin, because in different way it's difficult. The 2 ml is a nice amount of a product to use. It's not an ml, so there are 2 ml. I usually, it's nice because you can spare from half face 1 ml and the other one, then 1 ml right and 1 ml left. But it's more difficult to push on your syringe to inject. So you.
Another question.
I'm happy. I'm with you for this reason. So.
Can you use KARISMA like a skin booster, for example?
Skin booster, sure.
Everywhere?
Sure. Everywhere. I don't use it in the lower eyelid because I'm worried that I can have a swollen in the lower eyelid. Everywhere else, you have seen, I've been using on the neck, I've been using around the eye, I've been using on mainly medial and inferior third, especially on this area, on the contour will be nice because it change the contour without be something sagging, swollen on this area that is not nice. It's an improvement. Remember that it's not, you are not going to cancel everything. Like with Botox, you know that we can have a nice results where we use it, and it's going to, let's say that 90% of the time you can cancel the wrinkles. But it's lasting 4 months and it's changing the face. If you do the Botox, most of the time you can see you've done the Botox. This is something very natural. For this reason, I started to use it with men. When I started with the first one, they said, what are you doing? Don't worry, okay, it's my fault, let me do. And then it was nice because the result was really natural. This is the idea.
When we do something wrong, I don't know, what can you do?
What do you mean for wrong? First of all, you can wait. It will disappear alone. The real mistake that you can do is to be too superficial. These are the things that I will recommend you. Not to be too superficial, because the patient see what have you done, where is the product, is complaining, I cannot make my necklace because I can see these small bumps, so this is the idea. On the other hand, you can use cortisone if you have got something red or anything, any inflammatory reaction that you can carry. The problem want to be with the collagen, but and want to be with the hyaluronic acid because both of them, they don't give any allergy. can be with a carboxymethyl cellulose that can be something that give you an allergy, so the cortisone can be the idea. You cannot do anything really with the hyaluronidase, with the enzyme. Is working only on the hyaluronic, that is acid that is inside the product, but nothing else. It's very difficult to make a real mistake, and anyway will disappear alone.
What if you go with more profound and then